Yes, we are having increases cases, predominantly in the Sun Belt. We do know we are having more cases now than we did a week ago, 2 weeks ago, 3 weeks ago, 4 weeks ago. That is very clear. What I would like to point out, though, is that compared to where we were in April, we probably are having really less cases, slightly less cases than in April because of more testing. But there is no question that we're having a surge right now. We are approaching this with extreme seriousness. We have CDC teams in every single state. We visited 19 sites with surge teams. We're having surge testing. We're sending medical professionals. So it really is all hands on deck. This is serious, but we know how to stop this, and I'm sure you'll be asking me that. But indoor bars, indoor restaurants, mask, face coverings, incredibly important, physical distancing and hand washing. So we're all working to decrease the turnaround times, but let me put this into context. About half the testing in the country is either point of care, meaning 15 minutes or less, or at a local hospital, which is usually within one shift or certainly 24 hours. Now, the big commercial labs, of which Quest is one of them, we follow those turnarounds every day. And as of yesterday, over the last 7 days, one state was at 5 days average. 7 states were between 4 and 5 days. 18 states were between 2 and 3 days, and the rest were between 3 and 4 days. That is not optimum. We want to reduce that. It will be reduced. Even Quest, you talked about, received their emergency use authorization for pooling on Friday. That means they can put several samples into one. So that's one approach. And we're also really surging point of care testing. As we announced, every single nursing home will get point of care tests that will support the protection of our vulnerable, but also ease the burden on the major labs like Quest and LabCorp. So we have a whole team that deals with this every single day. And if you ask a lab here or there, they may talk about shortages or not getting what they want as a preference. But right now, because we've used the Defense Production Act, and because we've mobilized the industry, the federal government procures and distributes swabs and transport media to every state in the quantities they need. So basically, they place their order, we distribute them, and then the states distribute them to all the subcomponents. In terms of lab reagents, it is tight. There are certain lab reagents that everybody wants and not everybody can get. So we match the allocation to every state to make sure they meet their state testing goals. And remember, in June, the states really crushed their testing goals of over 16 million tests. And now we're routinely doing 750,000 to 800,000 tests per day. On Friday, I think our number was almost 850,000. So we are increasing, but this is a constant battle. That's why my team is working 24/7, including all weekend, to make sure we match those supplies. So we're in this position because we're increasing our testing maximally. You have a situation where there is almost an infinite demand. When we started out, we had trouble making 1,000 or 2,000 tests a day. Then we had a plateau at 300,000 and 500,000, and now we're really going to be pushing 1 million tests a day. So we will do as many tests as possibly that we can. Right now, we need to make sure we prioritize those, and that's one thing we're really importantly doing. Number one, hospitalized, the vulnerable, and we really do need to improve our turnaround times, primarily in areas and counties of outbreaks. I know you were just talking to the Miami or Hialeah mayor. That's one area we're going to surge. We will have a surge site in Miami this week that hasn't been previously announced. We worked on that with Florida this weekend. We did Jacksonville a couple weeks ago. We're going to do Miami this week. So it has always been a CDC guideline that if you are 10 days or more since the onset of your symptoms and you're 3 days or more symptom-free, you do not need to be retested. There was an alternate strategy that said, okay, you can also have a strategy where you're tested twice with negative 24 hours apart. And I was back there. This is when we were repatriating people and putting them into military bases. That is no longer necessary. We have lots of data now that shows that after 8 or 9 days, you cannot transmit the virus. The virus is gone. So what we are seeing now is people getting retested 4, 5, 6, 8 times, and that's completely unnecessary. And we also know that the PCR test can be positive, but you're not infectious. And so it's actually keeping people out of the workplace, out of schools, when they really don't need to be. So it wastes resources, it clogs up the system, and it's unnecessary. Now, the exception is if you're in the hospital or very sick or immunocompromised, you can shed virus for much longer. That's a different situation. So you do not need to be retested if you follow those clinical guidelines